Welcome everyone to the second video in the series of periodontal diagnosis for oral health therapists. Today's lesson will be based on the classification system that was developed in 1999. Your article on My Uni by Armitage is a really valuable resource to help you understand this material, as well as your textbook, the Wolf Book, which is the most awesome perio book. It's your colour atlas of dental hygiene in periodontology, and you will find this resource really valuable not only for this year but for next year as well. So I hope you enjoyed the session today. If you remember from our last lesson in class, we talked about how to write your periodontal diagnostic statement. We said that there are three main things you need to consider. The first one, is it generalized or localized? And how do we work that out? Well, are there greater than 30% of the surfaces affected, or are there less than 30% of the surfaces affected? The next thing you must consider is the severity of the condition. Is it mild, moderate, or severe? And sometimes severe is referred to as advanced. And lastly, what form is it? Is it an acute form? Or is it a chronic form, a more long-standing condition? So, your statement then, first of all, starts off with, 1, the locality, whether it's generalised or localised. Then you will make reference to the severity, whether it's mild, moderate or severe. And finally, you will make reference to the mode. Is it an acute form or is it a chronic form? Okay, so we're going to begin with the classification of gingival diseases, or gingivitis as it's known. There are two forms. There is the plaque-induced, meaning it's induced by bacterial accumulation, and the non-plaque induced. Now, with the non-plaque induced, these conditions are usually a ramification of a systemic disorder. It could be something like a lichen planus that's affecting the gingival tissues. It could be an allergic reaction. It could be a viral infection. Regardless of this, you usually would refer these types of conditions to the dentist, or you would refer them on to a periodontal specialist to get verification of the diagnosis. For oral health therapists, we are more involved with the diagnosis of plaque-induced gingival conditions. Now, this is the one where we'll concentrate on now and expand upon the different types of plaque-induced conditions. But just before we look at the plaque-induced gingival conditions, we need to have a clear indication or clear clarification to what is the difference between diagnosing a gingivitis issue or a periodontal issue. Let's have a look. They both have the presence of inflammation. Okay, so we can see inflammation in the gingival tissues in both conditions. So then you have to ask yourself, well, what is the main difference between the two? How can you tell if it's a gingival condition or a periodontal condition? And the key factor here is that with gingivitis, there is no loss of attachment. With periodontal conditions, you have loss of attachment. You also have apical migration of the junctional epithelium. And you also have loss of alveolar bone. Now, all of these, if you remember from last time, can only be verified by the presence of radiographs. So you need to refer to your radiographs to make sure that you can detect a clear loss of alveolar bone and you can actually look at the alveolar crest to see whether or not there's been any sort of apical migration of that junction epithelium in relation to the pockets that you are. Okay, so now that we can tell the difference between gingivitis and periodontitis, we're going to have a closer look at the plaque-induced gingival disease and how that is actually classified. So firstly, we can refer to it as plaque-induced gingival disease with no local contributing factors. In other words, this case is just due to plaque accumulation. We also have plaque-induced gingival disease with local contributing factors. And what we mean by this is that we might have a rotated tooth where the cleaning is a little bit too difficult, so you can get a little bit more progression of the gingivitis in that area than what you would in an area where there was no crowding. But there is a list of other local contributing factors, and that is going to be your homework task in a moment. We also have what's referred to as necrotizing ulcerative gingivitis. This is an acute form, and it's actually very painful and associated with fever. But we will have more on the acute form of this ulcerative type in our later lessons. We also have hormonal associated gingivitis. Now, these are conditions that are actually worse than the gingivitis that's there, such as pregnancy, puberty, and a stack of other sort of hormonal conditions that I'll also ask you to research. We then have the diabetes-associated gingivitis. And that's usually, again, in diabetics who can't really control their sugar levels very well. We also have the drug-influenced gingivitis. And what we mean by this is that there are some drugs, like anti-epileptic drugs, that cause an abnormal hyperplasia or an abnormal reaction to the plaque that's there. And then we have our vitamin C deficiency gingivitis. So, just to summarise, we have our plaque-induced gingival disease that has no local contributing factors apart from the plaque that's building up. We have the plaque-induced gingival disease that is worsened in some areas by local contributing factors. We have our necrotizing ulcerative gingivitis, that is our acute form. All these other forms that we're referring to here are our chronic forms. Then we get to our systemic conditioning factors, as they're referred to, like our hormones, systemic conditions like diabetes, drug-influenced gingivitis, and our vitamin C deficiency gingivitis. So that's our plaque-induced gingival conditions in a nutshell. And these are the ones that, as an oral health therapist, you will be diagnosing. Okay, now for your homework exercise and in preparation for our class where we'll be studying the diagnosis of plaque-induced gingival disease in more detail, I'd like you to create your own mind map and elaborate on examples of local contributing factors, examples of some of the hormonal conditions that actually affect the progress of plaque-induced gingival disease, and elaborate on some of the drugs that influence the progression of gingivitis as well. So to summarise, you need your own mind map, you need to elaborate on local contributing factors, hormonal conditions, and drug-influenced gingivitis. In other words, what type of drugs influence the appearance and progression of gingivitis. Thanks, guys.